We thought that we would sort of just remind you of the SNRS mission, because it seemed very appropriate to sort of the focus of this presentation. And I think as we present the individual researcher awards, you will see how much these researchers have actually started to have facilitated this particular mission. The SNRS Distinguished Researcher Award, which was established in 1996, had the following purpose: to recognize the contribution of an individual whose established program of research has enhanced the science and practice of nursing in the southern region and actually beyond. I think we really meant that, not just for the southern region. And so as Jean and I are now going to sort of be like I guess the Academy Awards or the Emmys. We're going to switch back and forth from now on in terms of actually presenting the distinguished researchers. And I see that there are some of you here in the audience, so I hope that when we talk about you, that you would at least stand and be recognized by your colleagues. So actually, as you had already heard, that D. Jane Wood was the first recipient of this award. And at that time, she was at the University of South Carolina. She is now retired and in Michigan, as you heard. And her work really looked at utilization of nursing research. And the NINR director at that time said of her work that this was pioneering research that made the case for NCNR. Jean was a leader in graduate and doctoral nursing education at these various universities. She also, because of her work with the organization, the board began to offer the SNRS D. Jean Scholarship Award. And that really goes to a presenter at the conference, and another way to recognize the fine work of our membership. And she also has mentored a lot of future leaders, and you can see Mary and I are here on the stage. Deborah Wallace is here, and she's one of our historians, and so I think that Jean's influence has been tremendous. It's my pleasure to actually present the 1997 award of Barbara Holtzclaw, and I saw her. Is she here now? There she is, Barbara. Of course, Barbara and I, we were early popcorn eaters in the airport, and so I've known Barbara for a long time, and she was the research dean at the University of Texas Health Science Center in San Antonio, and as you can see, she's now interim. She never stops working. She's supposedly retired from San Antonio, but she's the interim assistant dean for research at Oklahoma University College of Nursing, and also obviously a faculty in the PhD program. And she's the director of their traditional translational science training for the university at this Donald Reynolds Center for Geriatric Nursing and Excellence. I can't read the screen. As many of you know, Barbara's research really has focused a lot on thermoregulation, so that she really raised the consciousness of that shivering in an oxygen-consuming, fatiguing phenomenon with sequelae for vulnerable patients. She certainly taught me a lot about this when we were at San Antonio. And findings from her 2 major intervention studies demonstrated that shivering can be modified or prevented by insulating large thermosensitive regions of the skin, extremities. Her interdisciplinary research has advanced bidirectional translation of nursing and basic science. She is really a pioneer in translational research. Congratulations, Barbara.
I have to tell just a little story about Barbara and I. We were serving on SNRS board together, and I was a brand new board member and did not really know Barbara very well, and we were flying back. I think we were both we must have been in Texas at that time, and Barbara had food poisoning, and our planes got delayed, and we had to spend the night in a hotel somewhere, and Barbara and I got to know each other very well. So I've always remembered that. It is my great pleasure to do the 1998 Distinguished Awardee, and this is Dr. Cornelia Beck, who happens to be one of my very good friends. And she is at the University of Arkansas for Medical Sciences. She's at the College of Medicine in Geriatrics and the College of Nursing, where she is a professor. And the title of her presentation was Kaleidoscope. I want to acknowledge that she received a Lifetime Achievement Award from the National Gerontological Nursing Association and the Maureen Reagan Award from the National Alzheimer's Association. Very large awards for a nurse. So. It's not working. Here we go. For those of you that know Dr. Beck, she has really been a pioneer in Alzheimer's disease and with persons with cognitive impairment. And she was one of the first principal investigators to work with persons with cognitive impairment and determine that they can maintain functional abilities longer if activity of daily living assistance is individualized to maximize their remaining cognitive abilities. And this really has impacted quality of life for not only persons with cognitive impairment, but also their caregivers. She also has done a lot of work with problematic behaviors of persons with cognitive impairment and found that these problematic behaviors are decreased when persons are engaged in meaningful activities that match their interests and abilities. So it's not just a cookie cutter that we do one type of activity and say that it works for everyone, but we try to maximize their own interests that they are still able to participate in. She's also done a lot of work, and more recently in quality of life in nursing homes, and is trying to really structure partnerships, and has found that by doing this, we are able to improve care in nursing homes when we have partnerships that are approached by mutual goal setting among residents, family, staff, and owners of the nursing facilities. She also has done work with delayed and immediate memory of community dwelling elderly, and has determined that it can be improved with a lay educator delivered cognitive improvement intervention. So you can see that she's done a lot to really work with cognitive impaired individuals. She also is the first nurse, and I believe the only nurse, to direct an NIA-funded Alzheimer's disease center, which has impacted the lives of many, many individuals. She is a seminal researcher in Alzheimer's disease and is really a wonderful mentor to many, many people sitting in this room. The 1990 recipient is Joanne Harrell, professor, University of North Carolina at Chapel Hill. And her topic was physical activity in children. And I'm very familiar with Joanne Harrell's research since it's also in cardiovascular. Are you here, Dr. Harrell? Stand up. I also was remiss in saying that Dr. Beck had a family emergency and was not able to attend, but wanted to be here also. Okay, back to Dr. Harrell. Her research has been really, really groundbreaking research, and it focuses on promoting health, preventing obesity, preventing type 2 diabetes, and risk factors for future heart disease in school-aged children, which is the future of our country. She has presented data from her studies to help pass legislation to mandate an increased amount of physical education in North Carolina schools. So in other states, we're decreasing physical education requirements, and we've seen risk factors increasing in our children. Dr. Harrell's research was able to really provide evidence about why we needed to increase physical education, and was able to have North Carolina actually pass that legislation. Her research has been instrumental in changing physical education programs in North Carolina school system and can serve as a model for all the other states. So she's been instrumental in improving cardiovascular health in our children. Thank you, Dr. Harrell.
It's my pleasure to present the 2000 awardee, Barbara Parker. And I don't know if Dr. Parker is here. Is she? No. She is the Teresa A. Professor of Nursing at the School of Nursing, University of Virginia, and her title of her presentation was Incidence of Violence in the Year Before and Following Pregnancy. Dr. Parker has worked a lot with intimate partner violence. She conducted an empowerment intervention for abused women in conjunction with Dr. Judith McFarland, who is also a distinguished researcher. She also has worked with Rick Steves to really study the experience of children growing up in a home where one parent killed the other. And obviously is continuing to do a lot in terms of violence associated with pregnancy. Dr. Parker really increased the recognition of violence and the impact on health in women and children.
Dr. Allen can't do her own, so I read it. So you all know who she is here. And as you heard, she is the Dean, University of Maryland. The title of her presentation was Weight Management in Ethnically Diverse Women. Her program of research has been varied but very important. Probably what I remember the most and has impacted my life the most is the work that she did, her qualitative work with weight management practices among primary care providers and management of normal and overweight Euro-American women. She's also looked at patterns and processes of weight management among Black urban-dwelling women and cross-ethnic African-American, Euro-American, and Mexican-American study of weight management. And she really has been a pioneer in getting us to look at how culture, races, etc., impact a person's view of what is overweight, what's ideal body image, etc. And it really opened up our eyes, I think, to some of the impact of culture on health.
The 2003 awardee was Diane Holditch Davis, and I think she's here. I think I see her. Stand up, please. She's the Marcus Hobbs Distinguished Professor of Nursing and Associate Dean for Research Affairs at Duke University. Her title of her speech was Predicting and Improving the Developmental Outcomes in at-risk infants. In the interest of time, we're going to sort of speed up a little bit in terms of, so we want to get through everybody's program of research. But you can see that her program of research has great depth and has focused over the years on high-risk infants, looking at, parent-child interactions, the long-term effects of mothers administering sort of tactile interventions, decision-making around late preterm infants, social and biological risks in high-risk infants, and the effects of chronic lung disease and complications of prematurity on infant sleep-wake cycles. I mean, she has made tremendous contributions and has been instrumental in improving infant health. The 2004 awardee was Susan McMillan. Is Susan here? There she is. Great. She is the Lyle and Beatrice Thomason Professor of Oncology, Quality of Life Nursing, Distinguished at the Distinguished University Health Professor at the University of South Florida, our sponsoring university. Her focus was psychosocial behavioral, I did it, didn't I? Sorry, Kathy. It's Florida. Wrong one. That's like saying, yes, I understand. Yes, we have to have some humor. Psychosocial behavioral interventions on quality of life of hospice patients and caregivers. Dr. McMillan really has focused on symptom assessment and management in persons with cancer, the quality of life of hospice patients with cancer, again has developed a quality of life index, a caregiver quality of life index, and a constipation assessment scale. She has really made tremendous contributions to the improving the life of cancer patients near the end of their life.
Marion Broom. Is Marion here? She's left the South, unfortunately. We'd like to get her back, but I don't think we're going to have any luck doing that. But she's Dean and Distinguished Professor, Indiana University School of Nursing. She's also the editor of Nursing Outlook, an official journal of the American Academy of Nursing, and she was the 2005 Distinguished Researcher. And the title of her presentation was Chasing Rainbows, Lessons Learned as a Pediatric Nurse Researcher. Marion's research has really been involved with testing interventions to address pain, specifically relaxation, distraction, and imagery with children with cancer and sickle cell disease and those undergoing surgery. She's also investigated and done research in pediatric research with ethical issues, particularly those associated with consent and assent for research. And that may seem like something that we commonly accept now, but Marion, her work has really done some of the preliminary work that makes it so commonplace today for assent and consent in children. And she is a leader in improving pediatric pain and protection as subjects. Judy McFarland, is Judy here today? She was our 2006 recipient. She's the Perry Chair in Health Promotion and Disease Prevention at Texas Women's University in Houston. Title of her presentation was Prevention of Interpersonal Violence Against Women. Her research has focused on health effects of violence against women and children and effectiveness of interventions to prevent further violence in the household. She's been instrumental in bringing the problem of violence against women to the forefront.
The 2007 distinguished researcher was Dr. Rick Steves, and I don't think he's here because he is now retired and doing other things, but he was a faculty member from the University of Virginia, and his program of research was really around the experiences of children growing up in a home where one parent killed the other, and has been a long-standing colleague of Dr. Barbara Parker. He also did a lot of work in qualitative methodology, and he really has made major contributions in that area of writing about qualitative methods.
Nancy, are you here? Dr. Nancy McCain, the 2008 awardee, who is the director of the Biobehavioral Science Core of the Center of Excellence in Biobehavioral Approaches to Symptom Management, now that's a mouthful, at the Virginia Commonwealth University. And the title of her presentation was Research in Psychoneuroimmunology. Nancy's program of research has focused on psychoimmunology and has focused on testing interventions for stress management in persons with HIV infection and in women receiving chemotherapy for breast cancer. She has significantly contributed to the advancement of knowledge of biobehavioral mechanisms, measurement systems, patient outcomes, and focused nursing interventions.
It's my pleasure to introduce my colleague, the 2009 winner, Dr. Barbara Smith, and she's over there. She's our Associate Dean for Research and Professor at the University of Maryland School of Nursing, and the title of her presentation was Aerobic Exercise Symptom Management in HIV. Just to be more dignified, I didn't actually put the picture in of how Barbara presented her topic because she borrowed my crab hat. And if you remember, she had this big red crab hat on as she presented her presentation, but this is a more dignified picture, Barbara. Her program of research has really, again, focused on individuals with HIV. She's primarily looked, because she's an exercise physiologist, she really has looked at aerobic exercise and its effect on symptom management. She's looked at HIV-related hypodystrophy in women, the effects of exercise on a variety of these factors that are listed on the slide. And she's looked at physical activity and nutrition interventions in HIV related to lipodystrophy. She also more recently has been being more international, and she's looked at protecting healthcare capacity by preventing occupational transmission of HIV disease among health professionals in Africa. So Barbara Smith has made, really tremendous contributions in improving the health of persons with HIV.
Sandy Dunbar, are you here, Sandy? Sandy was our 2010 recipient. She's the Charles Howard Chandler Professor of Cardiovascular Nursing and the Associate Dean for Academic Advancement at the Neil Woodruff School of Nursing at Emory University. And her title of her presentation was Lessons Learned from a Research Career. And Sandy's work is near and dear to my heart since it's cardiovascular in focus. And her research has been focused primarily on decreasing health disparities and psychosocial responses to serious cardiac illnesses like heart failure treated with implantable technology. She's also been testing integrated self-care approaches for persons with heart failure and diabetes, and testing interventions to improve outcomes of heart failure families and their caregivers, which is a very important area of research. Her psychoeducational interventions are assisting to improve outcomes of high-risk arrhythmia patients treated with implantable devices such as ICDs. She has significantly contributed to improving heart failure outcomes. I might also add that she is the chairperson of the Cardiovascular Nursing Council of the American Heart Association also.
Well, this is a preview for tonight. The 2011. G. McSweeney is the 2011 Distinguished Researcher, and you already know that she's a professor and associate dean for research and director of the Tailored Biobehavioral Interventions Research Center at the College of Nursing and the University of Arkansas Medical Sciences Center. Her actual topic tonight, as a preview, will be Reflections from the Heart. As you all know from the introduction, that Jean's long-term research has been with cardiovascular disease and women. She was one of the pioneers in actually identifying that women have different symptoms when they are experiencing an MI than men, and that many of their symptoms were missed because health practitioners were using men's symptoms as a guide to assessment. So she's also investigated cultural and racial differences in women's CHF symptom experiences and developed an instrument, MapMIS, that captures women's descriptions of chest discomfort and symptoms. And she's really been someone who's been able to very clearly combine qualitative and quantitative research methodologies in her research. And she's really been a seminal researcher in describing women's cardiovascular disease symptoms.
Have to add, Janet taught me qualitative methods, so she had to get that little piece in there about combining. In summary, the SNRS distinguished researchers have investigated health issues across the lifespan in a variety of cultural and research groups, and I think it really shows you how our research has impacted health, not only in the United States, but we hope across the world. We've been pioneers in translating our research into practice and improving quality of life. Now, all of us have had some type of mentors, and we wanted to close talking just a few minutes about mentoring. And mentoring is a dynamic interpersonal relationship between an expert and a novice characterized by mutuality of interests and needs, empowerment, accessibility, agreement on roles, and willingness to commit to the endeavor. All distinguished researchers had mentors and are our mentors. Mentoring promotes scholarly caring and thus commitment to excellence, nurturance of future and current scholars, and the collaborative production of knowledge for the discipline. And we want to briefly share our experiences here.
Well, I actually personally believe in sort of that collaboration and mentoring are critical for all of us in terms of developing and sustaining a program of research. And I really believe that collaborative mentoring, which is that mentoring that involves mutuality and empowerment, is it's a very effective kind of mentoring. I had the experience as a doctoral student and as a new researcher to have 3 mentors who actually modeled that kind of collaborative mentoring for me. It enabled me actually to then be able to mentor students and colleagues in that same mode of mutuality and empowerment. And I think as a mentor, I received more from mentoring than I ever gave. Mentoring expanded my thinking, it expanded my research program. Doctoral students were able to take concepts that I was using in my research and use them in their own research and expand them and improve on them. And I think almost most important, it actually led to lifelong colleagues. And such as G. McSweeney, who actually her career has far surpassed my research career. She's nationally and internationally known for her work. She's on major national, critical nursing research bodies, and she is president of this organization. Mm-hmm. And more importantly, again, she's a lifelong colleague.
Thank you, Janet. Janet was my dissertation chair, and as such has continued to mentor me in many different aspects. So it wasn't just about how to get my dissertation done and be able to graduate, but she has been able to advise me over my entire career about what awards, where should I submit a grant, what are good journals to submit to. She would critique things for me. I mean, she helped me in a variety of aspects. She encouraged me to run for the nominating committee and for the board at SNRS, and was a role model as to show me how she was able to mentor, continue to do research, and to serve as president of SNRS. So I'm just trying to encourage every one of you to think about that with your own mentoring. We all need it at every stage. And it's been my fortune to be able to mentor people like Dr. Tricia Crane, who is going to be your incoming president of SNRS, and many other doctoral students. But mentoring is not something that is in this little box that you do for a year or two and they graduate and you're done. I mean, I continue to review grants for Tricia, et cetera. I try to model what Janet has done for me, and we're encouraging each and every one of you to do exactly the same thing. So when that doctoral student comes to you, or that new faculty member comes to you, or that mid-level researcher comes to you and wants help, please remember that and mentor them also. And mentor them into this organization. This organization gives us a wealth of opportunities and is a springboard to so many things. So please remember when you are mentoring to encourage them to attend SNRS.
So, in conclusion, first I think Jean and I would like to congratulate all of our distinguished researchers who are here and not here today, and I think we should really congratulate them. And I think apropos, we're going to, Dr. Francis Collins, before he became director of NIH, did actually a commencement address at the University of Maryland, so I'm actually stealing from his commencement speech. But he talked to the students before he played on his guitar, which was wonderful, that he believes that we all should partake of 4 principles to balance and structure our lives. And they are: be serious and dedicated to your profession, which we all are doing right here, and we do in our daily lives. But as important, to develop your own spiritual base, how to fill your inner self, love and care for one another, and he really means not romantic love, but just caring and respect. But you also can have some romantic love in your life, I hope. And mentoring, it's part of, I think, love and caring for one another is really part of what Jean was talking about in mentoring. And last but not least is have fun, and this organization knows how to have fun. So in closing, we just have a few fun pictures. Well, they're fast. That was fast. Let me go back. I wonder if I can go back. Let's see. This one? Nope.
Let's push it again.
Try it again. That was a perm I had a long time ago. I'm glad that was fast. This is Barbara and I honking it up.
Push it again.
Yeah, now they just go. Okay.
I guess it's no more.
should.
Oh, there we go.
This is a group of former presidents, as you can see, and Kathy Sawin, who I think is here, and also a board member, having a party. That's a wonderful hat. Also, some former presidents, Donna Hathaway, Deb Wallace. These are some students presenting at a poster session. Kentucky.
That was the calling to the post or something, I think it's called, before a horse race. And they actually came in and did that. It was really a wonderful, I think it was before our main session even began.
That looks fun.
Yeah.
Again, a more former president, that's Marge White over on the far left, that some of you may or may not know. And of course, there's Mary Walker, Deb Wallace, Donna Hathaway, Jean Wood, G. McSweeney, and Craig Stotts, all former presidents. And finally, more Kentucky.
Yes. That was at the Kentucky Derby, I think.
So thank you all very much.